All right, thanks everyone. So I'm here with Amanda Craig, who's a PhD student. I'm Akhil Shenoy, I'm a psychiatrist here at Sinai. And we have Ravel, who is an outside consultant. And we came together to give you something called Synco. We're Team Synco. So we all know that this is a huge problem. I don't need to reiterate the specifics, but one of the big problems with chronic pain and chronic opiate use is that the pain score that's used as both a measure for outcome measures, but also as ongoing assessment is inadequate. And so our goal is to make a better pain score. So to develop a better pain score is a complicated thing. But I think much like, if you can imagine for diabetes management, the hemoglobin A1C, how it's transformed as an outcome measure, it's transformed how we manage diabetes care, or even the APGAR, how it's transformed obstetric care and neonatal care, really. I think we can come up with a series of measures that can probably better distinguish sensory pain from affective pain. So one of the concepts is a pain anchor. Another concept is distinguishing details of the patient's self-assessment, and the other is physiologic measures, and combining all of these into one platform. So one of the ideas about a pain anchor was, this is a little bit new, is having the blood pressure cuff, which is already being used as one of the 4 vital signs, as the sensor for a better sensor for establishing a baseline pain measurement. So you could have a person kind of engaging pain when they're getting their blood pressure taken. And while that's being done, and this is our app, the new 5th vital sign, revitalizing pain assessment, we would engage the patient to start, while they're in the clinic, getting the pain anchor, and as a baseline assessment, we're asking them to press on the physical body where the pain is most intense, what parts of the body are involved, and even tracking for radiating pain where the pain could be going. In addition to that, we'd want to get baseline qualifiers for the pain. So stabbing, shooting, cramping, those kind of descriptors would be helpful to then feed back to the patient for intensity. So, and then obviously mood tracker, anxiety tracker, and then interlaced at the question of the day could be other questions about disability scales along with addiction scales. So the patient should be getting something back from this, pain management tips and a calendar to track their symptoms, and also a word cloud to kind of describe what their pain is like and how it compares to other people's pain. So out there in the market, there's really just pain diaries that are standalone pain diaries. There's also vital signs kind of trackers, nothing that's really integrating the two. And nothing that includes a pain anchor, which could be, again, something standardizing about pain. So I think this could be used. One of the applications is that the point of contact could be an initial pain consult at the primary care clinic before referral to pain management, before that happens, 1-month tracking, and then so the patient can bring back this data and the physician can review it before referral. I think it would be profitable through offering it to pain clinics or to even larger hospitals, because there are really not enough pain clinics to manage all these patients. Eventually kind of scaling up to all general practitioners, because one of the goals would be to offer a better outcome measure that could be used by all GPs. And other goals that could be profitable are reducing pain prescriptions and perhaps licensing this, and then offering Synco because the data itself could be very valuable on this platform, offering Synco as a subscription service for hospital systems to collect information. Thanks.
Okay, Sam, you may have a question regarding just pointing out towards you for how the blood pressure machine translates into dolorimeter. I like the name, by the way.
So there is some research recently in the last 5 years about using blood pressure cuff for subjective measures of pain while the pressure is being applied, reporting pain to the practitioner, and then how that distinguishes fibromyalgia pain from other types of syndromes like osteoarthritis or rheumatoid arthritis. And there's distinguishing features about, sort of allodynia, hyperalgesia seems to be more prone through blood pressure cuff. So, but our idea would be to hack the original, like the Bluetooth inside a blood pressure cuff that's already there. I think Peter was describing this to me, is hacking that so that we could get the output from that and having it synced up to our app so that we could collect the pain and the blood pressure at the same time.
Is the patient going to be reporting the pain as the blood pressure cuff is being used?
That's the idea, and that's what shows in the research. But so right now, when vitals are taken and the fifth vital sign is being collected, it could be taken. That question could be asked at any time when the nurse or nurse's aide is taking the vital signs. And so I think it'd be more sensitive at the time when the blood pressure is getting taken, and the patient would have the opportunity to actually show the pain with a brush while the blood pressure is getting taken. So it's real time, and it'd be able to kind of overlay those two data points.